And joining us now is Dr. Joshua Sharfstein, the Vice Dean for Public Health Practice at the Johns Hopkins Bloomberg School of Public Health. Dr. Sharfstein, you heard Richard. What about, first of all, the vaccine rollout here? It's been a lot slower than anticipated. How much of concern is the variant in terms of it spreading more rapidly than people are getting vaccinated?
Well, I think the metaphor of a race is a good one, that this variant is spreading quickly in the United Kingdom. It's likely going to spread quickly here. For that reason, we really have to be hitting all our marks on the vaccine rollout.
And the FDA said today that they plan to stick with the 2-dose coronavirus vaccine regimen and not cut the Moderna dosage down as well. Both options have been tried in the UK to try to get more people at least some immunity. They say here that the science just doesn't bear that out. What is your opinion?
I agree with Dr. Fauci and the FDA that we should stick to the regimen that was proven to be 95% effective. But even with that regimen, we should be trying to get as many people vaccinated as we can, particularly in the high-risk groups. I think that there should be a quantity strategy where we are opening pharmacies, vaccine centers, and we're not falling behind as the supply comes in, getting people vaccinated, and a focus strategy with outreach teams to senior housing, to congregate living centers, to high-risk workplaces, so that people who are really in harm's way can be vaccinated. And that is going to require a lot of resources, some of which were just appropriated by this latest bill, but haven't reached the state and local health departments that really have to mobilize a major effort to be successful.
Dr. Fauci told Newsday today that he hopes the general public could have access to COVID-19 vaccines as soon as April, those who don't have other outlying issues. Take a listen to that.
I think by the time we get to April, we will be at that point where a normal man or woman who has no underlying condition and no reason to be at a high risk can get vaccinated if they want to.
Right now, that is not happening. We're not on track for that at all.
Well, I think that that's an important goal, but that's not the only goal, because if we just have a passive strategy of waiting for people to come in, we may not get enough people. Enough people might not wander in. There's a lot of hesitancy out there. We have to be aggressively explaining the vaccine, answering people's questions, and going to communities that may have some doubts and offering them vaccine right there in a comfortable setting to be successful. Because to work, we have to vaccinate people who are at very high risk, both of getting sick or of being in a position where they could pass on the virus. And that's going to require both this strategy of getting enough vaccine and just making it available, and an active, focused strategy of outreach.
Well, I don't see any federal major effort in that direction as of yet.
It may be coming.
We should hope. Dr. Josh Sharfstein, thank you very much.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.